We're going to return now to our top story, the plan to roll out the COVID-19 vaccines from early next year. A report by the high-level task force on vaccination will be sent to the Health Minister today. It'll be considered by the Cabinet on Tuesday. It'll be a large-scale logistical operation. GPs and pharmacists are likely to be involved in immunisations. There'll also probably be mass vaccination clinics. I'm joined by Darragh O'Loughlin, who's a pharmacist and Secretary General of the Irish Pharmacy Union, and by Dr Denis McCauley, a GP and Chair of the IMO GP Subcommittee. You're both welcome to the programme this morning. Denis McCauley, how do you see the role of GPs in the rollout of the COVID vaccinations?
I think at the present minute, I think, as I would have mentioned previously, it depends how easily the vaccine is going to be transportable in the cold chain to be delivered to GPs. I think at the present minute, we would assume that a certain amount of vaccines will come in January. This will probably be the Pfizer vaccine if it's approved by the European Medicines Agency. Mm-hmm. It will be a technically difficult vaccine to work with. It comes in packs of about 1,000 doses. There's about 200 vials in it. So it'll really depend how that gets on. But I would imagine because general practitioners are so important in putting this vaccine out, we're the group who are going to identify the risk group that needs to be done. We're the people that are going to give the good information to the public to reassure them that it's fine, and we're probably going to ensure that they get their actual second vaccine also. So, and finally, this is what we do. We do this all of the time. We're good vaccinators. We are good at picking out the at-risk group. We're good at reassuring that at-risk group, and we're good at making sure that we maximise the amount that is given in the quickest possible time.
But do you anticipate, and I think Gabriel Scally raised this point, that if your commitment to this vaccination programme is so great, that the other medical aspects of your practices could suffer, and there could be delayed diagnosis and treatment in other areas?
I think it's without doubt. There are going to be 8 million doses of this vaccine given. To say that the GPs are going to give all 8 million is sort of madness. But we're going to be intimately involved. But we gave the flu vaccine in Donegal in the middle of a surge of COVID, and we were also kept our surgeries open to look after the normal medical issues also. So remember, we do this. We know how to do it. We know we can do it in a number of hours in a day. For a number of days a week, and we can run our surgeries the rest of the time. I think it is difficult to do, but we're used to actually doing it, and we've done it particularly under the very stressful circumstances that we had recently. And
Darragh O'Loughlin, you do it for flu vaccinations. Do you see pharmacies being involved in providing vaccinations for COVID?
Pharmacies will certainly be involved because, as you say, we are heavily involved in flu vaccination and have been for a decade, and over the last number of years pharmacies have given hundreds of thousands of flu vaccinations. This is a huge undertaking from a national perspective, and certainly it's my view that, as Dr McCauley has said, everybody who is capable of delivering a vaccine service safely is going to have to be involved in this. There will be up to 8 million doses administered to the Irish people. No one group can do that on their own. So pharmacies are delighted to be involved and to be participating and to be supporting this national effort in the same way as GPs and the HSE themselves. And do you anticipate,
Darragh, that it perhaps might be further down the line as further vaccines come on stream and as we move through the population that the pharmacies might step in?
The pharmacies will be involved as early as is practicable, and certainly with the Pfizer and BioNTech vaccine, which, as we know, has to be stored at minus 70 degrees and comes in a pack of 975 doses. That's a tricky one to handle. We shouldn't over-mystify it. There are other vaccines coming down the track. That'll be the first one to be approved, but there will be others that can go in the normal cold chain and that can be stored in the fridges that are available in pharmacies and in GPs. So there are logistical challenges to be overcome, but I've no doubt that if we put our heads together and think about how this is going to be done, it can be done. Even the Pfizer-BioNTech vaccine can be kept for 5 days in a fridge. So it's a question of deciding at what point do those packs get broken into smaller quantities, and how are those smaller quantities distributed to where people will get their vaccine.
Any conversations taking place yet, Dr McCauley, with the HSE, with the Department of Health, on the GP role?
Yeah, I'm just finished a meeting of it this morning with the GP liaison group with the HSE about the COVID crisis generally. But we were planning for the vaccine rollout. We have members of the Irish College of General Practitioners and the Irish medical organisations nominated for the HSE implementation group when it is fully formed. But at the same time, we're having meetings this morning about the information process, how best to ensure that we get the best information to the general public so they can make a good assessment on the safety of this.
Because
I think it's just.
Sorry, Dr. McCauley, there are legitimate concerns, and people will have heard those stories of the allergic reactions in 2 cases, I think, in the UK. So there will be concerns that you will be called on to allay.
Oh yeah, I actually think so. I think this vaccine is ultimately going to sort of conquer COVID. It is. We still have to take precautions in the meantime, but ultimately, at the end of this path, at some stage this year, we will have conquered this. So I think the vaccine has that benefit. Does it have some side effects? You are prone to get reactions, local reactions in your arm. That is the primary thing. And I think we just have to explain to patients, if you get this vaccine, it's going to help you get back to a normal life. Will you have a sore arm for a few days afterwards? Yeah, in about 60 or 70% of the time. Could you have a headache for a day or 2? Yeah, you could. But listen, if it gets you to the final pathway, we have to explain to them there's a risk-benefit analysis, and overall a sore arm for 2 to 3 days is better, and to get back to a normal lifestyle. We just have to take the fear and the mystery out of it, explain it in the best possible way.
Dr. Denis McCauley, Darragh O'Loughlin, thank you both.